Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 23rd lecture on systemic pathology. Today, day 1 of diseases of respiratory system. Dear audience, today's topic is emphysema of lung. Before going to discuss about the emphysema of lung, we want to recapitulate about the different types of chronic obstructive pulmonary diseases. COPD, chronic obstructive pulmonary diseases. Emphysema of lung, bronchial asthma, chronic bronchitis, and bronchiectasis. Emphysema of lung, bronchial asthma, chronic bronchitis, and bronchiectasis are the COPD, chronic obstructive pulmonary diseases. Now come to emphysema of lung. Dear audience, what do we mean about emphysema of lung? It is one of the chronic obstructive pulmonary diseases characterized by abnormal and permanent dilatation of air spaces with destruction of wall, distal to terminal bronchiole, is known as emphysema of lung. It is one of the COPD, chronic obstructive pulmonary diseases characterized by abnormal and permanent dilatation of air spaces with destruction of wall distal to terminal bronchiole. Dear audience, suppose this is the terminal bronchiole TR and this is the respiratory bronchiole RB. This is the alveolar duct AD and this is the alveoli. This respiratory bronchiole, alveolar duct and alveoli make an acinus. So acinus is composed of respiratory bronchiole, alveolar duct and alveoli. If there is abnormal dilatation of this air space and if the dilatation is permanent and if there is destruction of the wall, by definition this is emphysema. Now come to types of emphysema. Dear audience, emphysema of 4 types. Centriacinar type of emphysema. In this type of emphysema, the proximal part of acinus is affected. proximal part of a sinus is affected. Distal or paraseptal type of emphysema. In this type of emphysema, the distal part of a sinus nearer the alveolar septum is affected, so it is called paraseptal. Distal part of a sinus near the alveolar septum is affected. This is centriacinar. This is distal type. Panacinar type. Panacinar type of emphysema, entire acinus is affected, that is respiratory bronchiole, alveolar duct, alveoli all are affected. Respiratory bronchiole, alveolar duct and alveoli all are affected. The fourth one is irregular type of emphysema. In this type, some portion is affected and some portion is unaffected. Some portion is affected and some portion is unaffected. Some portion is unaffected. So there are four types. One is centriacinar, proximal part is affected. Distal emphysema, the distal part is affected. Panacinar, entire acinus is affected. Irregular type, some portion is affected, some portion is unaffected. Dear audience, now come to pathogenesis of emphysema of lung. Elastase and anti-elastase theory of emphysema of lung. This theory states that imbalance between elastase and anti-elastase, that is imbalance between trypsin and antitrypsin is associated with emphysema of lung. Dear audience, there is trypsin and antitrypsin in tissue of lung, and trypsin and antitrypsin remain in balance, so there is no destruction of tissue in the lung. In physiological condition, trypsin, that is elastase, and antitrypsin, that is anti-elastase, remain in balance. so there is no destruction of tissue of lung. Dear audience, what happens in emphysema of lung? What happens in emphysema of lung? There is imbalance between trypsin and antitrypsin. In emphysema, either trypsin is increased or antitrypsin is decreased. In emphysema, either trypsin is increased or antitrypsin is decreased. As there is increased trypsin and decreased antitrypsin, there is destruction of tissue of lung and thereby there is emphysema. Dear audience, now come to what is the cause of imbalance of trypsin and antitrypsin. Now come to what is the cause of imbalance between trypsin and antitrypsin. Cause of imbalance between trypsin and antitrypsin. Cigarette smoke is the cause of imbalance between trypsin and antitrypsin. Cigarette smoke is the cause of imbalance. Dear audience, now come to role of cigarette smoke. Role of cigarette smoke. Cigarette smoke acts upon alveolar macrophage release of chemotactic agent from macrophage and recruitment of neutrophils in the alveoli of lung. Recruitment of neutrophil in alveoli of lung. Nicotine of cigarette smoke acts as chemotactic agent for neutrophil. Nicotine of cigarette smoke acts as chemotactic agent for neutrophil. Cigarette smoke acts upon neutrophil, mast cell and alveolar macrophage, and there is release of elastase, that is release of trypsin. Cigarette smoke acts upon the recruited neutrophil, on the mast cell, and also on the alveolar macrophages, and from this cell there is release of elastase or release of trypsin. Oxidants of cigarette smoke and oxygen derived free radicals oxidants of smoke and oxygen derived free radicals from neutrophil and macrophage inhibits alpha 1 antitrypsin. So, oxidants of cigarette smoke and oxygen derived free radicals from neutrophil and macrophage inhibits alpha 1 antitrypsin. Dear audience, trypsin released from the neutrophil and mast cell, and inhibition of alpha 1 antitrypsin is associated with imbalance between trypsin and antitrypsin. Increased level of trypsin or increased level of elastase is associated with this imbalance. Increased trypsin and decreased antitrypsin is associated with imbalance between trypsin and antitrypsin. Due to increased trypsin, that is due to increased elastase, destruction of tissue, and emphysema of lung. Dear audience, I have told you abnormal and permanent dilatation of the air spaces, distal terminal bronchiole with destruction of wall is known as emphysema. Dear audience, respiratory bronchiole, alveolar duct, and this is the alveoli. Trypsin or elastase acts upon the wall, causes destruction of it, and ultimately there is abnormal and permanent dilatation of the air spaces. Dear audience, again elastase and anti-elastase theory for emphysema of lung. Increased elastase or increased trypsin with decreased anti-elastase or antitrypsin is associated with destruction of the wall, and ultimately there is permanent and abnormal dilatation of the air spaces distal to terminal bronchiole, and there is emphysema of lung. If anybody suffers from emphysema of lung, what will be the histopathological findings of emphysema of lung? Now come to histopathology of emphysema of lung. Histopathology reveals abnormal fenestrations in alveolar septum. If this is the alveoli and this is the alveolar duct, this is the alveolar septum, there will be abnormal fenestrations. These are fenestrations, and these fenestrations are very much abnormal. Destruction of alveolar septum. Dear audience, as there is destruction of alveolar septum, multiple alveoli fuse together and forms an abnormal large air space. Destruction of alveolar septum, fusion of alveoli, and formation of abnormal large air space. These are the histopathological findings of emphysema of lung. Abnormal fenestrations in the alveolar septum, destruction of the septum, fusion of the multiple alveoli like this, and formation of abnormal large air space. This is the histopathological findings of emphysema of lung. Dear audience, if anybody suffers from emphysema of lung for a long time, what may be the consequences of emphysema of lung? Consequences of emphysema of lung: cor pulmonale, respiratory acidosis and coma, massive collapse of lung secondary to pneumothorax. So, cor pulmonale, respiratory acidosis and coma, massive collapse of lung secondary to pneumothorax. These are the consequences of emphysema of lung. First come to cor pulmonale. Dear audience, you know heart disease following lung disease is known as cor pulmonale. Emphysema is followed by pulmonary hypertension. And due to pulmonary hypertension, right ventricle cannot pump blood in pulmonary trunk effectively. Right ventricle cannot pump blood in pulmonary trunk due to pulmonary hypertension effectively. And the right ventricle is to pump forcefully. Forceful pumping of right ventricle, and this is nothing but work overload of right ventricle. Work overload of right ventricle. Due to work overload of right ventricle undergo enlargement. Right ventricular enlargement, and ultimately right ventricle may fail. Failure of right ventricle. Dear audience, in emphysema there is pulmonary hypertension. Due to pulmonary hypertension, right ventricle cannot pump blood effectively in the pulmonary trunk. There is forceful pumping action of the right ventricle, increased workload of the right ventricle, and right ventricle under enlargement, and ultimately there is right heart failure. This is core pulmonary in emphysema of lung. Dear audience, now come to respiratory acidosis in emphysema of lung. Emphysema of lung. You know, in emphysema there is abnormal and permanent dilatation of the air spaces distal to terminal bronchiole. Emphysema of lung. Lung cannot remove enough carbon dioxide, so there is excess carbon dioxide. Due to emphysema, lung cannot remove enough carbon dioxide. As lung cannot remove enough carbon dioxide, there will be excess carbon dioxide, and excess carbon dioxide is associated with decreased pH in blood and other body fluids. Excess carbon dioxide is associated with decreased pH in blood and in other body fluid. As there is decreased pH in blood and in other body fluids, the blood and the body fluids become too acidic. Blood and body fluids become too acidic, and this is known as acidosis in emphysema of lung. As this acidosis is due to emphysema of lung, this is known as respiratory acidosis. Dear audience, now come to massive collapse of lung in emphysema. Suppose this is the lung, and this is the pleura, this is the pleural space. Suppose these are the alveoli, peripheral alveoli in the lung. Dear audience, we know in emphysema there is distraction and penetrations in the alveolar septum. Emphysema distraction of alveolar septum in periphery of lung. What will happen? Air from the alveoli will enter into the pleural space. So entry of air in the pleural space. The black one is the air. Entry of air from alveoli in pleural space. Due to excess accumulation of air in the pleural space, the lung will be collapsed, and the lung will be collapsed like this. This is the collapsed lung, and The black one is the air. Again, in emphysema, there is destruction of alveolar septum. If this destruction in the peripheral part of the lung, there will be entry of air from the alveoli in the pleural space, and due to accumulation of air in the pleural space, there will be massive collapse of lung. This is the collapsed lung. Dear audience, today I have discussed briefly about the emphysema. It is one of the chronic obstructive pulmonary diseases characterized by abnormal and permanent dilatation of air spaces with destruction of wall distal to terminal bronchiole. 4 types of emphysema: centroacinar, distal, panacinar and irregular type. Elastase and anti-elastase theory for emphysema of lung. There is imbalance between the elastase and anti-elastase, that is imbalance between trypsin and antitrypsin. Cigarette smoke is associated with emphysema of lung. Cigarette smoke causes increased trypsin and inhibition of antitrypsin, so there is destruction of the wall and ultimately abnormal and permanent dilatation of the air spaces. Histopathology reveals abnormal fenestrations and destruction of the alveolar septum and formation of large air spaces with fusion of multiple alveoli. There are consequences of emphysema: cor pulmonale, heart disease following lung disease. There is right ventricular failure and enlargement following emphysema. Respiratory acidosis, as lung cannot remove enough carbon dioxide. Accumulation of carbon dioxide is associated with decreased pH of the blood and other body fluids, and the body fluids and blood become too acidic. This is acidosis due to emphysema, and it is respiratory acidosis. And lastly, I have told you massive collapse of lung. It is due to pneumothorax. The pneumothorax is due to destruction of the alveolar septum at the peripheral part of the lung. This is all about the emphysema of lung briefly. Today up to this, thanks all.